When the rains started in North Queensland last summer, they didn't stop, with Townsville copping a record-breaking drenching. For 17-year-old Camille and her mum Danica Lay, the constant wet conjured memories of 2019.
We used to get that mottled, like the purplish bruising on your shins.
At 11, Camille was healthy and active when she was struck down with a mystery illness, with extremely painful raised nodules on her skin.
Sometimes the pain was just unbearable and I'd have to come home. I remember like drawing circles around the dots and then the next morning waking up and it'd be way bigger than the circle or something like that. It was a lot.
All up, Camille had just shy of 50 blood tests, x-rays, ultrasounds, CT scans, MRIs, biopsies, needle aspirations. They did the works.
Her condition was finally identified as the soil-borne bacterial disease, melioidosis.
We were just very lucky that that one particular doctor had run those tests.
Not uncommon in the tropics, melioidosis lurks in deep soil, but during periods of heavy rain, the bacteria can be brought to the surface.
It's predicted that with climate change there will be more severe weather events, and with that it's likely that there will be an increase in melioidosis cases.
It's not just a changing climate which is a concern for the spread of the disease. In Hong Kong and Singapore, cases have been linked to developments, with many theorising that increased heavy works are disturbing soil and uncovering the bacteria in urban centres like Townsville and Cairns.
It's a lesson learnt in Darwin.
Certainly with construction of new suburbs around Darwin, there has been an increase in cases potentially related to that sort of activity.
75-year-old Lynn Coomber has been in hospital for several weeks.
They didn't immediately stumble on what the problem was, but they obviously realised something wasn't right.
Authorities suspect she caught the bug from rain inundation to her third-floor apartment.
Yeah, no, I didn't have any interaction in mud or anything like that, so I was a little bit bewildered about this.
It's cases like hers that have the potential to burden the health system.
A substantial proportion of patients develop septic shock and require intensive care unit admission, which is also quite resource intensive.
The mortality rate in Australia is between 10 and 15%, but in Southeast Asia it kills about 70% of those infected.
Sadly, when it kills people, it does so very quickly and very efficiently.
Dr. Robert Norton is a retired microbiologist. He's showing us how the disease often presents.
But you could tell that this child had severe pneumonia.
To diagnose, samples need to be taken and grown in a lab.
The biggest problem with diagnosis is that it can mimic a lot of different diseases.
While Camille is once again thriving, her mother wants to see a greater focus on the disease that caused her daughter so much pain.
There's certainly a level of complacency, but I feel like the messaging that goes out there is very narrow with regards to what symptoms to look out for, precursors that make you susceptible. Certainly would have saved us a lot of heartache.